whether you're starting to go bald or maybe your hair is just starting to thin, let's face it, losing our hair is not a subject that most people like to discuss, but it is a fact of life for many people, men and women. Perhaps you've thought about hair restoration. Dr. Julie Hattier of J.J. Hattier Medical Aesthetics specializes in hair restoration, and she joins us now to tell us more. Thank you so much for joining us this afternoon. Now, Dr. Hattier, hair loss affects so many people. Why do you think it's a touchy subject?
Well, I think for men and women, we all feel like our hair is our crowning glory. It shows our femininity for men, their masculinity. We feel like when we're losing our hair, it's really showing our aging process. And also our hairlines. When we look at a face, that's where we notice when the hair is the stop point for looking at a patient's or a person's face. So when we're losing our hair, it's very embarrassing for men and women.
Why do we lose hair to begin with?
Most of the time it's a hereditary problem, and that comes from mother and father's side. And 52% of men, it's testosterone issues, that they have follicle receptors on the top of their head that causes them to lose their hair.
Right, and both parents you mentioned.
Both parents.
Because I think people think it's just the mother.
No, it's not just the mother. And then of course in women, we have hormone changes, whether it's pregnancy, menopause, thyroid issues. And so sometimes some of that's correctable, but once the hair is completely lost, as in thyroid issues, it's done. But with hormone issues, with pregnancy, usually the hair will grow back.
Now what about stress? Does that cause us to lose hair?
Stress can cause us to lose hair. But that, again, usually is just a temporary issue. And once we restore the proper nutrition or get rid of the stress in our lives, then the hair will resolve itself and grow back.
Now, many of us have heard about the hair plugs, and of course there's the spray for hair and all that. Is that considered hair restoration?
Well, the old plugs, that was 20 years ago. It was plugs. We took out like 1 centimeter plugs and plugged them in the top of the head, and it looked terrible. But it was permanent hair. And now we can correct some of those old plugs and make that look a lot better, and that was permanent. But the hair spray, the coloring, that's just temporary to kind of fill in the gap.
Right, right. And what you do is, do you actually transplant the hair?
We do. We transplant the hair 1 follicular unit at a time with follicular unit extraction. It's an automated system that we use in my office. It's called NeoGraft. And we take it from the donor area, the back of the hair, and we transplant 1 hair at a time into the areas that are needed.
Oh, and that, you can see that picture. That looks great.
Yeah.
Is it permanent?
It is permanent. The hair that we transplant from the back, those are the hairs that are not affected by the hormone problem. And so those hairs will be permanent where we put them. Now, when patients still have a little bit of their own natural hair left, that hair will continue on the top of the head to be affected and may thin. So we want to treat that as well with medications and topical agents to make sure that we're taking care of the hair that's left.
So since you're transplanting it, it's actually their own hair. It's not somebody else's hair you're putting on the head.
No, nobody can donate hair to you to transplant. It's from your own hair in the back of the head. That area of the hair is very rarely do we lose that hair.
Right, right. Now this is for men and women, all ages.
Men and women, and in my office we've done a 50-50 because many women have the thinning in the top here and sometimes even the recession, which can come from mom or dad. So we take that full area in the back, we remove 1 hair at a time, and then we transplant that into the thinning areas up in front.
Right, right. How long does that take about?
It depends on how many hairs that we're actually having to transplant. Anywhere from 500 to 2,000 hairs we do in 1 session. 2,000 hairs is about the size of a CD. So, and it takes about 5 to 8 hours, a 5 to 8 hour day to do that. So very comfortable. We have a facility that's very, very private for that all-day procedure. We break for lunch.
Yeah.
So,
what about maintenance after you get it done?
Maintenance with the NeoGraft method is Very, very easy because it's a no scalpel, no suture method of hair transplanting. The old strip method, which has been around for a long time and still is used a lot, where a whole piece of strip of the back of the head is taken out and then transected and transplanted one at a time also. There's a lot of recovery on that.
Right, but there's no recovery.
Neograft.
Go back to work. Pretty much.
3 days, you're back to work.
Right.
You're back to normal activities.
For more information on NeoGraft Hair Restoration by J.J. Hattier Medical Aesthetics, go to delmarvalife.com and click on the Show tab. And something else that can help you achieve the look you want, your body cleanser. Up next on Delmarva Life, Samantha B. from The Daily Show with Jon Stewart joins us to tell us how we can put our body cleanser to the test and win one of more than 20,000 prizes. But first, the Ringling Brothers Barnum and Bailey Circus is coming to town next month at the Wicomico Youth and Civic Center in Salisbury, and we want to give your family tickets to see the show Thursday, March 7th. We're giving away a total of 10 family 4-packs through March 6th. For your chance to win, go to delmarvalife.com, just click on the show tab. Now at the left side of the page, to find a complete, or go to the left side of the page, find a complete set of rules and the entry form. Good luck, and we want to congratulate today's winner, Angela Allen from Lincoln in Sussex County.